Welcome to Clean and Comfort. It's 7:36 p.m. And today we have Dr. Linda Carr and Elizabeth with us talking about the past and the future, 2020, 2021. Good evening, everyone. We may have some guests joining us, just popping in. So, a couple of strange folks may just be joining us. How are you guys doing?
Holding up. We're doing well. I'm looking forward to 2021, and I am hoping that we do have positive change. I don't think we can get any worse than 2020. There are so many things in this year that I would like to put in the past and move on, out with the old and in with the new.
I'm with Dr. Carr. I'm out with the old, in with the new. Looking forward to 2021 and have some hope for the vaccine and hope for a good and positive year.
Yes.
So Liz, I understand you took the vaccine already. How did that go?
I did. I received the vaccine last week after our frontline team members in the critical care and emergency room were vaccinated, and I was waiting online. I received my vaccine card, and I was doing really great. I had no side effects. I didn't even feel the needle going into my arm. When I stood up and I said, "That's it," the nurses said, "That's it. How do you feel?" And I said, "I feel great." And then I have to say, I was overcome with emotion and I shed a few tears. The nurses hugged me and we had a couple of seconds of celebration and feelings of hope, and I left, and then I went out and told 20 more people, please go get your vaccine.
I thought you were going to say you had a drink with the nurse.
No. I'm waiting for my second vaccine on January 7th to have a cocktail. I'll have a cocktail then. I didn't want to mix alcohol with my vaccine.
Good job, Liz.
Thank you.
Well, I was on vacation last week and I didn't get my vaccine. I came back. I went upstairs to get my vaccine, and there was a line about 2 blocks long. And so I changed it for another day. Soon to come.
Yeah.
Dr. Carr, are they offering you guys anything yet in Philadelphia?
Well, I do see vaccine signs at some of the local pharmacies like CVS and Rite Aid. I have seen that the vaccine is available here. So I did see that, but because I am working from home, my job didn't mention anything about us being vaccinated. But we do see signs, and the vulnerable population are the populations that they're targeting first before they expand it to those who are believed to be much healthier or capable of surviving over the vulnerable population.
Right. So even if the signs are up, you're not able to just go get it.
Usually what they're doing is they want the elderly, or if you have some kind of previous diagnosis, health issue, you can go in and get the vaccine. And for my own unselfish reason as well, I'm not taking a vaccine that can go to someone who is maybe unwell. Myself, I kind of try to stay out of the way. I do go out and I will eventually take the vaccine, but because I'm so conscious and aware of, I have a big bottle of, what is it called, hand sanitizer in my car. As soon as I leave out of wherever I'm coming from, I always wear my mask when I'm around anyone out besides myself. Outside of the home, I wear my mask, come in the car, reach to the back, squirt, hand sanitizer, and then I take my mask off. So I make sure that my hands are sanitized before I do. But eventually I will go, but I haven't been offered yet. I did get an email from my PCP stating that they do have the vaccines and there will be stages of offering that vaccine to their patients.
Right. I think we're doing. I think you guys are a little bit ahead of us um, in Philadelphia because I don't think the pharmacies have it yet. Liz, am I right or wrong?
I believe that you're right. I think that's in the works, and there's conversation in New York State to the fact of how are we going to get this vaccine, who's next, and how are we going to get it out to the rest of the population. So I know that there are in New York State, and Cuomo put something out yesterday or today. So it's healthcare workers, frontline employees, and we know that we have to follow procedure on who in the hospital can get it first. So it was the emergency room, intensive care, COVID units, and then everybody else. And then other frontline, or I'm sorry, other first responders like our police and our EMS. So, and then I think they're gonna branch out to other populations, as Linda was speaking about, and follow certain guidelines, like this older population and people that are sick already, that have other diseases that might cause them to become more sick. So I think it's a similar rollout to Philadelphia and probably other states. And I know there was a lot of conversation in the news and in the media that how people think that the vaccine should be given out to people. But I really think frontline employees and first responders is a good start. And I also, to my team this morning, we talked about the new year and we talked about hope for the future. And we talked about the fact that we are pioneers, not for the first time, but for in 2020, pioneers not once, but twice. So first we're on the front lines and pioneers in this new pandemic. And now we have an opportunity to be pioneers and courageous again and heroic for our community and show them that the vaccine is safe and the vaccine is effective. So I think this is a really great way to show the community for another time this year our support.
Right.
Just to piggyback off of that, my mom actually went out to get the vaccine and they did not have it available. So I don't know if we want to say that they're doing so well yet or give them, their accolades for something, because even though the signs are up, Mom went to get vaccinated and they didn't have any. So I'm not sure how that's going to pan out. As I stated, I'm not really in tune 100% because I know that I won't be in that first batch of people who get the vaccination. But for next one, for the next podcast, I'm going to go and do some research and see if I can get more information about how they're distributing and how did they identify who is available. I'm quite sure that will be an easy one for pharmacies to do because of they fill a lot of seniors and prescriptions, whether you're a senior or not. So they kind of have background information on your health status, your age, and all those different demographics that make sense. So that makes logical sense. And all that information can go back to your insurance company, and so they can know if you received the vaccine or not. But I'm definitely going to look into it more so I can have more details regarding the status and who's getting it, how much is available per day. Because like I said, Mom said, hey, I'm going to go get a vaccination. And she went to Rite Aid and they said they didn't have any. So I'm not sure if they only gave them 20 or if it's 200, 2,000. I'm not sure of the number, but I'll definitely look into it for the next podcast.
Right.
It's going to be interesting. We've already started hearing, I don't know which healthcare system it was. I was half paying attention as I was getting ready to leave the house, but vaccine that made it into the hands of a medical center or a clinic, and they should have never received it. So it's going to be interesting, but I believe healthcare workers and people exposed on the front line to COVID-19, and then nursing home. We lost a lot of nursing home residents, and that's their home. They should be safe in their home. And just because they live in a nursing home, that's their place where they should be safe and safe from COVID-19. So I know that all states are addressing nursing home and the people that take care of our parents and our grandparents in nursing homes, and then I guess workers with that work to keep our infrastructure going, and police, and and then of course people with underlying medical conditions, and then hopefully the rest of the general public as more vaccines become available and more doses of the Moderna and the Pfizer are ready. So hopefully we get some positive news, and by April or May, have a good portion of the population vaccinated.
Yeah. I did get a call. I got a text. Was it yesterday morning? A friend of ours who live in Erie, Pennsylvania. Her mom is in assistant facility, and she was a little bit concerned. And I think we mentioned in our last podcast, we previously talked about how a lot of the minority populations, especially African American and Hispanic, really don't trust the health system. And that goes back to, like we said, them being used for experiments unknown to them, as well as knowing even experiments where they knew that there would be devastating or dire outcome. And unfortunately, because of who they are, meaning Black or Hispanic, no one cared in healthcare. And at that time, we know that like the Tuskegee experiment, that is a huge experiment. And she was panicking, and she did not trust giving her mom the vaccine because, of course, now those stories are no longer hidden. And so I just explained to her, I said, are they forcing your mom to get it? And she said, no, she has the option to take it. I said, well, maybe just to make you all feel a little bit comfortable, if you would like to go through the second, have her vaccinated in the second round, but make sure that she's continuing to take all of the precautionary measures needed to assure that she doesn't contract COVID. So that gave her a sense of calm. And I also told her what we see, sometimes the internet, like Facebook or Instagram, all of the time we mainly highlight the negative come out of situations. So she saw those stories where people had negative side effects. And I explained to her that out of the thousands of people, that is probably not even a 1% of those who have those negative side effects. So that was something that reassured her. And I just told her to just do her research, so that way she can feel a little bit more comfortable. And she was at the end of the conversation. But
That's great.
We definitely need to do, Liz, not to cut you off, but we need to not only put it out there, but we need to, one of the things I think that they did poorly as a public health professional, I think once the COVID-19 virus hit America, I don't think that they utilized those within our communities who will more likely be trusted by community members to give the message of the virus and give more details about it. I think that's one of the things that they can do more, even though they do have, for our state, I know that we have our Pennsylvania Secretary of State, when the person who's in charge of health, she's transgender. So she does a lot of she does a lot of the information sessions. But one of the things that I noticed from a public health mind frame is nobody's going to really listen to her because they don't trust people that they don't know. And I think that what they could do and have to do a better job on reaching local communities is having local channels like Fox or whomever the local people have faces that are familiar with community members, give that information so they can feel more comfortable and feel like they can trust because they have previous relationships with these people. And I think that that's one of the big things that we're not doing, and that is going to cause a lot of people to be reluctant from